Snoring, causes, effects, and management of snoring. Snoring is the noisy breathing during sleep caused by the vibration of soft tissues in the upper airway. It can range from mild to severe and can disrupt both the snorer's sleep and that of their bed partner. Causes of snoring. Several factors contribute to snoring, which include 1. Obstructed airways. Relaxation of throat muscles and narrowing of air passages due to factors like obesity, enlarged tonsils, or nasal congestion. 2. Alcohol and sedatives. These substances relax the muscle, including those in the throat, leading to increased snoring. 3. Sleep position. Sleeping on one's back can cause the tongue and the soft palate to collapse to the back of the throat, obstructing airflow. 4. Age. As people age, their throat muscles weaken, increasing the likelihood of snoring. 5. Effects of snoring. Snoring can have various effects, which include 1. Sleep disturbances. Snoring disrupts the quality of sleep for both the snorer and their bed partner, leading to daytime fatigue and irritability. 2. Health risk. Chronic snoring can be a sign of obstructive sleep apnea, OSA, a condition associated with serious health risk such as heart disease, hypertension, and stroke. 3. Relationship strain. The loud and disruptive nature of snoring can strain relationships, causing resentment and sleep disturbances for both parties. 4. Management of snoring. Management strategies for snoring include 1. Lifestyle changes. Losing weight, avoiding alcohol and sedatives before bedtime, and sleeping on one side can reduce snoring. 2. Positional therapy. Using specialized pillows or devices to encourage side sleeping can help alleviate snoring. 3. Treatment of underlying conditions. Treating conditions such as nasal congestion, allergies, and anatomical abnormalities can improve airflow and reduce snoring. 4. Consulting a healthcare professional for proper diagnosis and management of snoring is very essential, especially if it is accompanied by symptoms of sleep apnea or other health conditions or concerns. Follow.